Hey, what's up?
What are blood disorders?
Alright,
There
so
are some blood
for
disorders.
some what?
Some blood disorders.
So blood disorders are known as hematological disorders, and it stems from issues usually in the bone marrow where hematopoiesis occurs or where blood cells are produced, right? So let's talk about the bone marrow, and let's talk about the three main blood cells that are created in the bone marrow. You have your red blood cells or your erythrocytes, and you should know that it's the average count is about 4 to 6 million for the healthy adult. Then you have your white blood cells or your leukocytes, and the average count for leukocytes is about 5,000 to 10,000. And then you have your thrombocytes or your platelets, and those are the average for those are about 150,000 to 400,000. At any point, whenever you have low production of either of those particular blood cells, well, you have some type of anemia, right? So let's talk about like regular anemia when you have a lack of red blood cells. Now, that's usually when your blood cells are not sufficient enough. You should know that your red blood cells are responsible for perfusion of the tissues, meaning they travel throughout the system, they dump off oxygen to the cells, and then they receive carbon dioxide and then bring it back to our lungs, and we can get rid of the CO2. Well, when you lack red blood cells, you have anemia, and the patient's going to be tired, they're going to be cold, they're going to have things like altered level of consciousness if it gets really bad. And the things that cause anemia are multiple. You have iron deficiency anemia, which is caused by a lack of iron consumption or ferrous sulfate. And that brings me to another point real quick, that you need three main components for blood cells to be produced. You need iron, you need folic acid, and you need cytocobalamin, which is B12. So when either of those three elements are lacking in the diet, the person's at risk for developing some type of anemia. So when they're lacking iron, then they develop iron deficiency anemia. You need to consume more iron, whether it's supplements or green leafy vegetables or organ meats like liver, because they contain a lot of iron. When the patient's lacking folic acid in their diet, then they may develop thalassemia, and that can lead to low white blood cell count as well. It can cause like fevers and things like that. When you have a lack of B12 in your diet, then you may develop pernicious anemia. And pernicious anemia is a little bit more serious because you should remember that folic acid and B12, aside from playing a role in hematopoiesis and the blood cell production, they also play a role in the myelination of the neurons. And so when you have those type of anemias, pernicious anemia or thalassemia, you will also have neurological issues like paresthesia, meaning that tingling sensation that you feel because you have a degree of neuropathy, and you may even develop like neurological issues as well. Then when you lack, specifically when you have thrombocytopenia or a lack of platelets, a lack of thrombocytes, well, now you don't have the cells that initiate the clotting cascade and you're at risk for bleeding. And so these patients are going to be, depending on what type of thrombocytopenia they have, they're going to be at risk for bleeding, usually from the onset of the diagnosis, or if they have things like if they're missing clotting factors, like in a condition called I can't think of it right now, but in the condition called hemophilia, then the kid's going to be at risk. Well, I say kid because you're born with this particular lack of clotting factor, and the clotting factor is like an element in the cascade of clotting that's required for you to clot. So if you don't have that, you're always going to be at risk for bleeding. Remember that these patients require cryoprecipitate, meaning clotting factors, as opposed to a transfusion of platelets. And then when you have leukopenia, not to be confused with leukemia, the cancer, when you have leukopenia, lack of white blood cells, the patient's going to be at risk for infections. They're not going to have enough white blood cells to defend them from any type of like environmental bacteria. And so those are the patients that you don't want to give them fresh flowers. You don't want to give them fresh fruits. You don't want to give them food that's undercooked, meaning the meat has to be well done and things of that nature. And you can give those patients medications like what's it called? I think it's called Neupogen. It's a medication that they give them. These medications, what they do is they stimulate the bone marrow to produce more of those specific white blood cells in this particular case. It's important also to note that people with myelosuppression, or people that are taking medications like chemotherapy medications, they suppress the bone marrow. So that's going to cause pancytopenia. And pancytopenia is when the entire panel of blood cells are deficient. So those patients are going to be at risk they're going to be at risk for anemia. They're going to be cold, tired, things like that, shortness of breath. They're going to be at risk for bleeding because they have low platelets, and they're also going to be at risk for for infections because they lack the white blood cells. So, in a nutshell, that encompasses like pretty much your hematological disorders, Papa.
Okay, thank you, Dada.